Hi, Dr. Ashley here with the Allergy and Asthma group of Galen. We wanted to make a video going over some of our common allergy medications and how they help our patients. Now, this video is not all inclusive. I'm going to try to keep it short, and obviously I could go on and on and on and on and on about medications to treat allergies because there's a lot of them. I mean, there's volumes written on these things, but I wanted to discuss with you what I tell most of my patients whenever they come in and see me for allergies and are interested in medication therapies. So one thing that's really cool about our allergy medications is that for the most part, they are very, very safe, even to use long term. In fact, most of them here in the United States are over the counter. Now, each medication has risk associated with it. I'll tell you, usually if we're recommending it, the benefits should far outweigh the risk. So if you look up any of these medications, yeah, they all have long side effects lists and some of them can be concerning, but talk to your doctor about using these if you would like, and that risk versus benefit discussion. So let's get into it. The first medication that I recommend to my patients is a nasal steroid, okay? Usually it's fluticasone, but there's also budesonide nasal sprays and some other ones that I won't go into. Most of them are used 2 sprays in each nostril once a day for adults. The thing to be aware of with intranasal steroids is that they may take 2 to 3 weeks to reach their full power. So this is one of those allergy medications that I say, hey, if you only use it every now and then, it's probably not working for you. But keep at it. After about a month of using it, hopefully you say, wow, these medications work great. The second medication I go to is usually an oral antihistamine. Now, in our guidelines, it recommends another nasal spray that I'll get to in a minute as the second go-to medication. However, I found that most patients don't like squirting so much stuff up their nose and they tend to tolerate a tablet better. And anyway, I like for my second medication to be a newer oral antihistamine. Medications like fexofenadine or Allegra or cetirizine or Zyrtec. I stay away for the most part from the older antihistamines such as diphenhydramine or Benadryl or hydroxyzine. Those older antihistamines typically don't work as well, and they just cause more side effects like drowsiness. Loratadine, which one of the trade names is Claritin, is my least favorite of the newer generation antihistamines. It typically doesn't work as well as the other two. And so after I've recommended a nasal steroid every day and an oral antihistamine, my next go-to is that nasal spray I was talking about earlier, a nasal antihistamine. There are a few different ones. Olopatadine nasal spray or azolastine nasal spray are the two generics that I can come up with off the top of my head. Those typically are 2 sprays in each nostril twice a day, which if you add that onto the Flonase you're already doing once a day, that's a lot of squirting stuff up your nose. But the good thing is with these is that they work fast, so you could keep them just as a backup to use on your bad days or use them every day to prevent symptoms in the first place. And most of my patients see a great benefit in their allergy symptoms with these. My fourth go-to with allergy meds, I shouldn't even say my fourth, I'll add it on to anybody that has ocular or eye allergy symptoms, is an antihistamine eye drop. Olopatadine eye drops are my first go-to. There's also ketotifen eye drops that I will use from time to time. Typically, these work really fast, and so it's nice for my patients when they're having itchy, watery eye symptoms of allergies. They can put 1 drop in each eye, either once or twice a day, depending on the medication, to relieve symptoms fast. And one pro tip, you can put those in the refrigerator and keep them in the refrigerator, and that way they feel cool and nice when you use them on your eyes. Now, those are just my 4 favorite allergy medications. Here's what's cool. Those are all over the counter. I typically prescribe them for my patients so that I can see if they're cheaper through the pharmacy and the patient's insurance. But if it's not, I tell my patients, go buy the generic over-the-counter stuff. It is the same thing and just as good as anything I can prescribe. There are some other prescription medications to treat allergies, such as Singulair or Montelukast. I'll tell you the negative with that is that I don't see that it works as well as the other ones. It only works in about 1 out of every 3 people, and there can be some behavioral issues associated with that medication. I use it, but it's not one of my first go-tos, and I've seen plenty of patients with benefit from it. There are other medications such as intranasal cromolyn, which is a little bit older and I hardly ever use, intranasal ipratropium, which I do use from time to time. So, if you struggle from allergy symptoms such as runny nose, congestion, itchy, watery eyes, see your doctor or see an allergy specialist. Anyways, I hope this video is going to be very helpful for you. Take care.